This video is about maxillary sinus polyp. Content: Introduction, Etiology, Clinical Manifestation, Diagnosis, Radiographic Presentation, Treatment and Prognosis. Introduction. Antrochoanal polyps are benign lesions that arise from the mucosa of the maxillary sinus, grow into the maxillary sinus and reach the choana, a nasal obstruction being their main symptom. ACPs are usually unilateral and appear in younger patients. Macroscopically, they have a cystic intramaxillary portion and a solid intranasal portion. Microscopically, they are similar to a maxillary cyst of the mucosa. The true etiology of antrochoanal polyps is unknown, but a case series review of 200 antrochoanal polyps found that the only significant risk factor is an anatomic anomaly. The most common abnormalities as noted were nasal septal deviation, inferior turbinate hypertrophy, and concha bullosa. Clinical presentation is usually with an obstructed nasal passage and or sinus symptoms. Occasionally, larger masses may prolapse posteriorly enough that they may be visible through the mouth as they hang down from the nasopharynx. Unlike other sinonasal polyps, antrochoanal polyps are usually found in non-atopic patients. According to a study, polyps of the maxillary sinus were obtained from 6 patients who had reported upper tooth extraction with oroantral perforation prior to the development of symptoms, from 11 patients with chronic sinusitis and from 12 patients with allergy. Histopathological features, scanning electron microscopy of the polyp epithelium, and clinical data were compared in those group of patients. The post-traumatic polyps differed from those of other etiologies by showing the presence of granulomas, less numerous inflammatory cells with very few eosinophils, nearly normal surface epithelium, smaller surface area occupied by non-ciliated epithelium, absence of epithelial squamous cells, normal frequency of goblet cells, rapid appearance of symptoms and shorter duration of the disease. It seems that the specific characteristic of the injury induced polyps results from a different mechanism of their formation involving primarily abnormal mucosal repair and to a lesser extent an inflammatory process. Diagnosis is mainly clinical via endoscopic examination and supported by computer tomography imaging. In CT images, the 3 components of the polyp can be identified: an intramaxillary portion, intranasal and choanal components. Magnetic resonance is also the main diagnostic techniques. Radiographically, sinus polyp appears as a well-defined, non-corticated, circular or globular, faintly radiopaque lesion. The lack of peripheral cortex surrounding the polyp signifies its origin from mucosa. The polyps may show high density centrally and have a peripheral rim of low attenuation on computer tomography scan, an important feature for differentiating it from tumors. Treatment and prognosis. Simple avulsion of the polyp has a high rate of recurrence. Minimally invasive endoscopic surgery is performed. The attachment site of the stalk is identified and excised along with a small cuff of adjacent mucosa. Visualization of the stalk base can be achieved in many cases via a medial meatotomy or may require the creation of an additional window through the inferior meatus. Recurrence rate is low if the stalk base is excised. Calvin-Luke procedure is associated with damage of the maxillary and dental growth centers. Thank you.